Herpes, causes, symptoms, prevention. What is herpes simplex? The herpes simplex virus, also known as HSV, is an infection that causes herpes. Herpes can appear in various parts of the body, most commonly on the genitals or mouth. There are two types of the herpes simplex virus. HSV1, also known as oral herpes, this type can cause cold sores and fever blisters around the mouth and on the face. HSV2, this type is generally responsible for genital herpes outbreaks. What causes herpes simplex? The herpes simplex virus is a contagious virus that can be passed from person to person through direct contact. Children will often contract HSV1 from early contact with an infected adult. They then carry the virus with them for the rest of their lives. HSV1. Infection with HSV1 can happen from general interactions such as eating from the same utensils, sharing lip balm, kissing. HSV2. HSV2 is contracted through forms of sexual contact with a person who has HSV2. HSV2 infections are spread through contact with a herpes sore. How do you get infected by herpes? Anyone can be infected with HSV, regardless of age. Your risk is based almost entirely on exposure to the infection. In cases of sexually transmitted HSV, people are more at risk when they participate in risky sexual behavior without the use of protection, such as condoms. Other risk factors for HSV2 include having multiple sex partners, having sex at a younger age, being female, having another sexually transmitted infection, STI, having a weakened immune system. Symptoms of herpes simplex. It is important to understand that someone may not have visible sores or symptoms and still be infected by the virus. And they may transmit the virus to others. Some of the symptoms associated with this virus include blistering sores, in the mouth or on the genitals, pain during urination, genital herpes, itching. Pictures of herpes symptoms. How is herpes simplex diagnosed? This type of virus is generally diagnosed with a physical exam. Your doctor may check your body for sores and ask you about some of your symptoms. Your doctor may also request HSV testing. This is known as a herpes culture. It will confirm the diagnosis if you have sores on your genitals. During this test, your doctor will take a swab sample of fluid from the sore and then send it to a laboratory for testing. Blood tests looking for antibodies to HSV1 and HSV2 can also help diagnose these infections. This is especially helpful when there are no sores present. How is herpes simplex treated? There is currently no cure for this virus. Treatment focuses on getting rid of sores and limiting outbreaks. It is possible that your sores will disappear without treatment. However, your doctor may determine you need one or more of the following medications: acyclovir, famciclovir, valacyclovir. These medications can help infected individuals reduce the risk of spreading the virus to others. The medications also help to lower the intensity and frequency of outbreaks. How to prevent the spread of herpes simplex infections. Although there is no herpes treatment, you can take measures to avoid becoming infected, or to prevent spreading HSV to another person. If you are experiencing an outbreak of HSV1, some preventative steps to take include: try to avoid direct physical contact with other people. Don't share any items that can pass the virus around, such as cups, towels, silverware, clothing, makeup, or lip balm. Don't participate in oral sex, kissing, or any other type of sexual activity during an outbreak. If you are experiencing an outbreak of HSV1, some preventative steps to take include: try to avoid any type of sexual activity. Try to use condom during intercourse. Research of Biogetica in herpes cases. Biogetica doctors carefully evaluate all research before formulating our groundbreaking kits. There has been growing research on numerous herbs, homeopathic ingredients and supplements globally for boosting immunity in cases of herpes. Biogetica now has published and pending patents owing to its groundbreaking work in the field. In one French study, 82% of the patients taking herpes nosodes benefited. We strive each day to give natural medicine the respect it deserves and hope that you will join us in this quest today. We vow to be with you every step of the way on the road from disease to ease that manifests each day. For more information, visit Herpes Cure. Contact us. Biogetica has doctors available 24 hours a day during weekdays and for 18 hours a day on weekends in order to guide you back to health and freedom with evidence-based national remedies. For more information, visit our site, www.biogetica.com.